Hi, everyone. How are you? I see Mary's back. It's been a minute. We were worried sick about you. Glad you're back. Um, a couple quick updates, and then I'm going to turn it over to other folks on the call here. So we have 2,293 positive cases. We're still at 91 fatalities. We are looking to open Lighthouse Point Park on a somewhat restricted basis for Memorial Day. We're also exploring potentially opening it over the weekend prior to Memorial Day. And we will be limiting the number of cars at the park at any time to 100. We've removed and are removing a lot of the picnic tables to reduce the likelihood of large groups gathering in one area. We'll have guidelines where people should have blankets on the beach 15 feet apart minimum. We will not be having lifeguards on duty. And so people can swim at their own risk. People will be asked to wear masks. So it's a somewhat limited, enjoyable time on the beach. But we're trying to, as are many of our neighboring shoreline towns, facilitate people being outdoors and enjoying Memorial Day while working to keep people safe. That's the good news. The bad news is we're canceling the fireworks for 4th of July. And we'll be exploring other ways that we can commemorate that day and celebrate with the community. But we've made an assessment, as have many other communities, that we won't be able to safely and easily ensure people don't gather in large groups. And so we've made the decision, we need to make it this early on to cancel the fireworks. Testing continues to go quite well. I visited the Lincoln Bassett site this morning, and there was a steady flow of people, including people that were just walking by. And I said to one woman, "Hey," she asked me what this was, and I said, "This is a test site. You want to get tested?" She said, "Sure." And she came in and got tested. And I think that that's one of the values to having these sites embedded in the neighborhoods, is that it's attracting people that might not be so motivated to go get testing, but it makes it much easier for them to do so. So we're very happy to Dr. Murphy's group, and also to the Medical Reserve Corps volunteers for helping stand up this site. Today, there were 4 Medical Reserve Corps volunteers in addition to the attending doctor. It's inspiring to see people that are willing to put themselves on the front lines and at risk as volunteers. I'm going to hand it over to Director Bond now to give an update, and then to Mike Piscatelli. You're on mute, Director Bond.
I actually can defer to Michael to give an overview of the reopening, and then I can jump in and give a health department update for food trucks afterwards.
Excellent.
Sure. Well, good afternoon, everyone. Nice to see everybody. So May 20th here in New Haven as well. Just give you a bit of an update. As you know, we did the webinars and practice sessions last week with many members of our business community, really emphasizing a responsible and safe reopening. So, not a flip of the light switch, particularly given the profile of our economic sectors. So we've got outdoor dining and we've got retail and office, all with a measured reopening today. We were able to check with the state. The total number of self-certified businesses now in the city is somewhere between 250 and 260. And that likely includes any number of barbershops and hair salons that we're getting in the process as well, before that was pushed back a little bit. We also have 8 applications in the pipeline for additional locations for outdoor dining. Really exciting to see some of the creative ideas that are coming forward. So those are moving through as well. If you were in downtown New Haven today, we've got staff around town just keeping an eye on things. It's still, relatively quiet and similar to what you've seen in the city, in recent days, as the offices start to slowly repopulate, if you will. So still heavy on takeout, but it was encouraging to see Harvest, Pacifico, and Jack's are just a couple of the restaurants that do have some limited outdoor dining set up based on their permits that were in place. And then also on Chapel and on Broadway, we had 6 retailers open, both on each of those streets. And again, just quick checks with the merchants, just a really nice slow start to, kick the tires a little bit, get the door open for the first time. Really want to thank so many members of our community that are coming out, but doing so in a very safe and measured way, if you will. Lots of people with masks on, which is good to see as well. Happy to answer any questions.
Director Bond, do you have something to add?
I do. So today, as Michael mentioned, is our reopening official day. We, as a team, reviewed the food truck applications. We have to date 13 on file, of which 1 is scheduled for this afternoon. Several are scheduled, 5 additional are scheduled for tomorrow, have met all of the requirements. There are 4 currently pending that are incomplete. And so we have made contact to remind individuals of the process. We also posted the process several days ago on our website, as well as making sure that it was emailed out. It was a co-letter with a workflow of instructions so that people can make sure they follow the protocols and not have any delays with opening. It's important to note that if you did not have an inspection by the fire marshal, the health department is not able to schedule your inspection. So we ask that you check your emails or your phone messages and schedule the necessary inspection with the fire marshal, and we will then make sure to schedule and get you back up and running. So out of the 29 slots, the health department has received 13 slots for the food trucks. And that concludes my updates. I'm happy to answer any questions.
Thanks, Director Bond. And we also are joined by Dr. Vasquez, who has been working, some of the press may be aware that there's a van that's going to some of the neighborhoods to provide support, healthcare support, in particular for infants. And Dr. Vasquez and her team have been working on that. We're deeply appreciative of the work that you're doing, and I just want to turn it over to you to share some of your experience.
Yes, thank you so much. So I'm a pediatrician at Yale New Haven Hospital and Yale School of Medicine. I've been here for about 25 years. And as biggest understatement, everybody knows this pandemic has posed a lot of healthcare challenges. And as pediatricians, we started seeing very early mothers postpartum and parents overall not wanting to come to clinics because they're worried about the spread of COVID in healthcare settings. And the population that I care for at the primary care center at Yale is mostly Medicaid underserved. And to come to clinics, they walk, they take buses, they take Ubers. So we knew that, this fear is real, that the exposures were real. So really trying to bridge and trying to bring the care to the areas, a group of pediatricians and I came up with this idea of the mobile medical van. And what this is really a way to support this critical period, and is taking the very traditional model of the patient coming to care and flipping it around, having part of the care come to the communities. And in a way, it worked out perfectly in terms of mapping, because when you look at the communities that we serve, those communities happen to be hotspots for COVID. And that's where our patients are who were not coming to medical attention. So we partner with the community healthcare van, who had been in New Haven for quite a number of years for a completely different purpose. And in the last, we started it as a pilot, and in the last 3 weeks, we've cared for over 60 patients, mothers, and their infants. This is done in conjunction with telemedicine. So the van goes to their areas, and in a very safe and organized manner, they have appointments. We will do things like weights for the newborns, checking their bilirubin, making sure that breastfeeding is going well, blood pressure checks for the mothers postpartum, and that is followed by a telehealth visit for both the mother and the infant. So it's really taking an innovative way to try to tackle an ongoing project. This is really a sort of something we were not supported. We had an anonymous donation. We can only run this van for about a month, so we really would love to find ways to support this important access that helps the communities in need. The other thing that I think is important to notice is that there are other things that we can do with the healthcare van. We know that the immunization rates all over the US as well as in Connecticut have decreased. And we would love in sort of a staged way to be able to provide care not only for infants and mothers, but for others to be able to do things like bring immunizations into the community. Thank you.
Thanks, Dr. Vasquez, for all your work supporting the community. And also appreciate New Haven Public Schools opening up, I know, some of their parking lots to the work.
Mm-hmm.
Are there any questions from folks? Go ahead, Kyle. You beat Tom Breen this time. So it was pretty incredible.
Well, I actually have a question for Dr. Vasquez. We did a story on the community healthcare van when it first opened. In that first week, there were 14 infants. So it's good to hear that there's 60 now. My question for you is, at the time, we were trying to figure out how the parents can schedule the appointment. So we checked with some of the clinics that the van says that they were partnering with, and the Cornell Scott Hill wasn't aware of it. And I never got in touch with Fairhaven Health. So how can we let parents know that want to use the van, how to get an appointment?
So the initial plan was to have all 3 large clinics participate. But in the end, Fairhaven and Hill Health they have other ways of seeing their infants. So as it stands, it's solely Patients for Yale New Haven Hospital, and how they get appointment is at the time the moms are postpartum and leaving the hospital, they're asked if there is a way for you to get care in your community. Would you want to? And for those who say yes, then these appointments are made.
Okay. And you're looking for additional funding to continue that service?
Correct. So the van has costs involved, staffing. So that's what we need to be able to continue it. And we're doing our part. We're writing, Dr. Leslie Sood and Rick Altiz, who are doing this work and are part of the team. We've written grants. We've reached out to March of Dimes, who already gave us a donation. So, this is something that came up very quickly, that in some ways it was sort of this heroic effort that we didn't even think we would be able to pull off this quickly. And it's going well, and it's very well received. But like many initiatives, it needs the bare minimum to be able to continue it.
Okay. And my last question for that is there a thought process in the future? I know you just mentioned that it's with Yale patients. Is there a thought on expanding it in the future?
We would love we would love to do that. Absolutely. I mean, I think of this as sort of a proof of concept, that it's a strategy that can work. It can work in many ways, as I mentioned, not just for mothers and infants, but this could be a phenomenal strategy for routine vaccinations, and eventually when we have a COVID vaccine, to be able to immunize an entire population. It's going to be impossible for patients to come to vaccines. We're going to have to go out into the communities like it's done in Latin America and in other parts of the world. But yes, I mean, that's what we would love to do, to expand it. But again, for that, it needs to be a bigger vision then.
Okay, great. Thank you. That's it for me.
Thank you. Let's go to Michael, and then Amber, and then Tom. And before, Mike, you asked your question, I was wondering why there wasn't as much of an uptick. We just got a data dump in our system, and so there's 2,321 cases as of today. We get the information in kind of big buckets, and that just was updated. 2,321 cases. Go ahead, Michael.
You're
You're on
muted.
mute. There you are. Go ahead.
Can you hear me? Okay. On restaurants, this is either for Director Bond or for Michael. Do you have, because they're permitted, do you have a total number of restaurants that opened outdoor facilities today, citywide?
No exact number. So there's a group that's going through permitting, others that have been through permitting. And the best tracking we have right now is actually the work we've been doing with Market New Haven on their website to put the entire list together. But just on a quick scan of who took advantage of day one, you noticed a couple of the downtown restaurants like Pacifico and Geronimo's, and you'll see more over the course of the week.
Right.
And I
Yes,
shared
sorry.
and so from our side, I did share a list of the outdoor vendor list and what we are doing, and I can get an updated spreadsheet of who made payments and renewed their license. So I can certainly get that information to you.
That would be great. I appreciate that. Thank you. And also, did your department begin restaurant inspections today? And can you tell how that went?
No issues reported today, other than the overview of just some issues with our food truck permitting process and making sure that we're clarifying the process with people.
And those 13 food trucks that went through the process, does that mean they're now allowed to be open?
Not at this juncture. We have one being inspected this afternoon, 5 scheduled for tomorrow, one following on the 22nd. And then we have 4 pending that need to still schedule and have been informed to schedule an inspection with the fire marshal.
And the ones that are getting inspected, say over the next 3 days, once they pass inspection, are they allowed to be open?
Absolutely, they'll be able to then function and be able to go to their allotted spots for vending.
Thanks, I wasn't clear on that. Thank you.
Absolutely.
Michael. Go ahead, Amber.
Good afternoon, everyone. This question is for Director Bond. I'm just playing catch up a little bit here, so forgive me. As we drive up and down the streets in the usual spots where these food truck operators are, we're not seeing any of them. It seems like there was some miscommunication as to how they go about getting their inspection. We spoke to a few who said they tried to get a hold of people at the health department. They couldn't get a hold of anyone. What exactly happened?
So there's a renewal process. All of these food permitting vendors, they're all renewing their application. They all submitted incomplete applications, all 13 of them. They skipped a process altogether, which was that they needed to get a inspection from the fire marshal. So we streamlined internally with the fire marshal, the permitting department, and my department to make sure that we set up a process that once they go through, permitting, then fire marshal, we then schedule the inspection, which is the last step. So there was incomplete information. There's also incomplete menus that were not submitted or qualified food operators. We have been contacting them since last week, sending messages and emails. One of the things that was brought to my attention today to ensure, and so what we also did, we also posted it, we co-issued a letter from the permitting department and the health department. And we also simplified the workflow so that although they're renewing their process, they can at least know what the steps are, just a little bit more simplified. We did that. And now I'm also translating the information in Spanish in case there's any language barriers to make sure that there is no literacy concerns around understanding the instructions.
And what was brought to your attention today? I'm sorry, I missed that.
Someone called me about the instructions being available in Spanish. And so we made sure that we requested translation. And so that we can make sure that information is also available in Spanish. I'll be joining a radio station in Spanish tomorrow where I'll be having a conversation around food trucks as well.
And just to go over the numbers again, how many are allowed to be open right now?
So right now, we have 13 applications that came in. They are 1 that's scheduled for this afternoon. None are scheduled to be open currently. They're somewhere in the process. So 5 are scheduled for inspections tomorrow. Another one on the 22nd, and 4 have been informed that they need to go to the fire marshal and make an appointment with them first.
Thank you, Director Bond.
You're welcome.
Thanks, Amber. Go ahead, Tom.
Thank you. Mayor, you gave an updated number as to positive cases. Is there an update to the number of fatalities as well?
It's the same, 91.
Thanks. And did you say that Lighthouse Park will definitely be open Memorial Day, or you're considering opening on Memorial Day?
Lighthouse Point will definitely be open Memorial Day. And we're considering evaluating whether we can open it earlier.
Thank you. And this may be best for Mike. Are you all keeping a running list of offices and retailers that are opening starting today in the way that y'all are keeping track of restaurants, or no?
So we just got the list of self-certifications. We'll review that and see which ones went through the process. It's a little different downtown because you have the multi-tenant buildings. So like a science park self-certifies for the entire building, and then you'll have the individual tenants do the same. And we're doing a round of reach outs today and tomorrow just to do a temperature check on how things are going. On the webinar on Monday, one of the panelists had talked about, even in the first couple of weeks, you expect about 20%, not even 50% occupancy in the office environment.
And I understand if this is a more appropriate question for Yale Properties, but I'll ask you anyway, in case you know. I know Yale had suspended rent, or Yale Properties has suspended rent for all or most of their shops for the past 2 months. Do you know if they are continuing to do that, or is everyone now on the hook for rent now that the partial reopening has begun?
So certainly a question for Yale Properties as opposed to us, but I think you hear it both from the tenants, the merchants, and Yale Properties, the extra efforts that everyone is doing to support some of our most treasured businesses. So if you're to walk on College Street today, you'll see some of the construction activity as they're readying up some outdoor dining spaces, use of the back parking lot. It's a very impressive effort to save really important businesses for our city.
Thank you. And then 2 more quick ones for Dr. Vasquez. Is there a phone number or a website that people can go to who do want to support the healthcare van through contributions or in any other way?
We haven't set it up, but they can use my email. I can either say it out loud now or send it through Mr. Frank.
Why don't you send it through Mr. Frank?
Okay.
Just be easier for everyone to have typed out. Or they can
Thank you.
just write a check to City of New Haven. I'm just joking. Go ahead, Tom, you had one more question.
Yeah, last one is for you, Mayor, about if today or sometime in the near future, you could give an update on the city support of homeless individuals who have been decompressed to hotel rooms. Is the city still supporting people in hotel rooms throughout the city? How many? How long will that continue to happen?
Sure. So I can give you the update that we know right now. So it's still approximately 200 individuals in several hotels. So that status has not changed. The state is funding the sites until May, the last day of May, and is working to get an extension from FEMA, where the funding comes from, so that funding will last for a longer period of time. We're obviously, as you know, the state's paying the bill for the hotel rooms. We're obviously very anxious to have more certainty around that, because if the funding runs out, we have a significant challenge on our hand. The only other update is that we are planning on testing everyone that is obviously willing to get tested, that is among the 200 individuals, as a part of our overall comprehensive strategy of testing as many people as possible, in particular vulnerable populations. And so Director Bond is going to be working with some of our partners to facilitate that happening.
Thanks so much. That's it for me.
Yep. Go ahead, Mary.
Just to follow up with Mike, you said it was maybe 250 or so people that are qualified now across the board. So was it just kind of a visual check today of which places are open? And then I went to other parts of the city, I guess, too, and you could find other restaurants. L'Orchio is open. And some are actually, a bunch are going to open it at dinner time, I think. But you don't have a comprehensive list. It's just.
So we have the list of ones that have self-certified, and you'll see the state sticker on the door at many of them. But correct, many will open up for dinner tonight. Possibly get that process started, if you will. And you see some retail stores that'll close around 4 or 5 tonight.
Right, there were a couple of retailers open. Ensign's, Fairhaven Furniture, they were open. Maybe just a question for Dr. Vasquez. Let's follow up. I think Kyle said you started out with 14 infants and now you're up to 60. Is that correct?
Mother-infant pairs. So the first day of the van, we saw 1 patient. It's only been 3 weeks. And now I think we've seen probably more than that because these numbers are from last week. Yes.
So at least 60 patients coming.
Yes.
Right. So I just have a follow-up question on if there was an investigation or just an audit check on some questions about money at the fire department. I'm just wondering if anything's come out of that. This was a few weeks ago, I think. Now.
This is the overtime question?
Right.
We'll get back to you on that soon. There, as was previously mentioned, there was an audit going on just to make sure that everything was used appropriately, and that has been conducted, and we can get back to you on that soon.
Okay.
I appreciate you following up on it.
Okay. It's always a drama when I try to get on Zoom, and I usually come in late. So the park is going to be open, Lighthouse. Were there any other announcements about parks or?
Fireworks are canceled.
Okay.
4th of July.
Right.
If you have other questions, you can always call me.
All right. Thank you.
Anything else? Going once, going twice. Thanks, everybody. Good to see you all. And thanks again, Dr. Vasquez, for all your work.
Thank you.
Thank you, everyone.
Thank you.
Bye-bye.